Welcome to this edition of Focus on Health. We're so glad that you're tuned in and joining with us today. I am Dr. Asante Hiltz, and I'm your host for Focus on Health, and we're excited to be talking about sickle cell awareness. Such an important topic, and join with me today is Tabatha McGee from the Sickle Cell Foundation of Georgia. We're so glad that you're here.
Thank you. I'm so honored to be here as well.
So tell us a little bit about you and Sickle Cell Foundation of Georgia.
So about me, I've been at the Sickle Cell Foundation of Georgia for 10 years, started off as a volunteer, and from a volunteer became an independent contractor, then a part-time employee, full-time employee, management, and then October the 1st of 2021, I was selected as the new executive director. The foundation has been in existence since 1971. It was founded by two African-American doctors, Dr. McGee and Dr. King, and they saw a need for education and awareness about sickle cell because one was a gynecologist and he was starting to see a lot of babies. The mother was calling us like, I have these babies and the baby's crying, I don't know what's going on, what's wrong with my baby? And his partner, Dr. King, was a blood doctor. And he was like, well, let's run some blood tests and find out what's going on. And they discovered it was sickle cell. So they started the organization, and here we are standing 53 years. I'm standing on the shoulders of giants, and I'm really excited to be here.
I'm so glad you're here, and I'm so glad to be talking about sickle cell because it's still a topic that a lot of people do not know about. We know that there are people around us who are living with sickle cell disease. We refer to them as our sickle cell warriors because they have to go through so much. But because we know there's not a lot of information for the masses to know about sickle cell, we wanted to bring this topic on our show today to really give that information to our community. Here in the Chattahoochee Valley, we know that we have several people, many people living with sickle cell disease. So let's just start with some conversation about what is sickle cell.
So sickle cell disease is an inherited blood disorder, and it is inherited by the parents, mom and dad. And so if the parents have sickle cell trait, more than likely the child is going to have sickle cell disease. It's a very chronic painful blood disorder. And individuals suffer because of the pain, because sickle cell doesn't have a look. So, when you think about cancer, think about the look that cancer has. Most individuals don't have any hair. When you think about sickle cell, individuals look perfectly fine on the outside, but inside their internal organs have really taken a major hit because of sickle cell. So the blood sickle, and because of the blood sickle, it doesn't allow oxygen to flow through the veins. And because of that, their major organs, it could be their kidneys, their liver, their spleen, their lungs, and it's very, very chronic and it's very, very painful. And unfortunately, today inside of the marketplace, we really only have one drug that has proven to really help individuals with sickle cell disease, and that's hydroxyurea. And hydroxyurea really is a cancer drug, but yet they use it for sickle cell. We did have a couple of other drugs that was available, but unfortunately it was pulled off of the market. So the only other time that our sickle cell warriors can get relief from sickle cell disease is through opiates. And opiates, as you know, long uses of opiate, it can have addiction, it can have major organ failures as well. And then we have gene therapy. Gene therapy, it has been successful in curing individuals with sickle cell. However, it's not readily accessible and available to the masses. And it's not available to the masses because one of the drugs for gene therapy is $2.1 million, wow, and the other is $3 million. And most insurance companies are not approving of it. So the individuals that did receive gene therapy, they went through a clinical trial in order to receive the gene therapy. And so, I would say that we have had some accomplishments inside of the industry, but we have so far to go. In the sickle cell industry, there's 100,000 individuals in the United States reportedly living with sickle cell disease, but we know it's many more because there is not a really good surveillance system that's put in place that we can really track individuals with sickle cell disease. Inside of the state of Georgia alone, it's about 14,000 reportedly. And the reason I say reportedly because I've been at the foundation for 10 years, and since I've been there, those numbers have stayed the same. But here's the very interesting thing about that. Every Monday, we get newborn screenings from the state of Georgia, every Monday. And every Monday, we are calling parents to inform them of what their child's status is. And we get the sickle cell trait results. We don't get disease. Disease goes to Grady. And 1 in 365 births result in someone with sickle cell disease. So then my question is, how can that number stay the same for 10 years when every week, every year, a child is born with sickle cell disease?
Right.
So it's a lot of work that we have to do, Ashanti, and I'm so happy to be here on the show today to talk about sickle cell disease, because what people don't realize in the Sickle Cell Foundation of Georgia and all of the other sickle cell organizations, you know, around the world, not just in Georgia, but around the world, because we're a small nonprofit organizations, we don't have the funding to constantly advertise on TV, billboards, radio stations about sickle cell. So we'll go places and people's like, oh, I thought sickle cell was cured, because we don't ever hear about it. Well, you're not hearing about it because we don't have the marketing dollars to really market and advertise over and over again that sickle cell is still here, is still prevalent inside of our community, and there are still people dying every day from sickle cell disease. There's mental health issues because of sickle cell disease. There's racism, there's stereotypes, there's social stigma associated with sickle cell disease. And so we still have a long way to go.
That's right.
A long way to go.
And that's my response to that is wow. Wow to many things that you said. Number one, wow to the fact that we have sickle cell warriors living amongst us who have to really struggle based on what you said, living with pain, not having a full range of medications to choose from. That's a big wow to me. The other big wow is the data and people not knowing the data. And the reason why Focus on Health exists is so that we can focus on those things and those individuals who may get left behind, who don't have enough awareness around that. So that's why this is important to talk about it. And so you mentioned that comparison to cancer and one of the medications for sickle cells being used for cancer. We have a lot of cancer awareness and cancer awareness days. And so I was excited to hear that we have a World Sickle Cell Day.
Yes.
So on the next slide, we're going to put up what World Sickle Cell Day is. Talk to us about World Sickle Cell Day.
So World Sickle Cell Day, they first created the day June 2009 to bring awareness about sickle cell from the United Nations. However, they now have Juneteenth on June 19th. So again, we were there to create awareness, but it's as if in some type of way they're competing holidays for June 19th World Sickle Cell Day. But it was put in place to really create awareness about this horrific disease that many of our individuals are living with.
And that's important. So, and that's the challenge, is because attention is being taken away from
Yes.
sickle cell and
Yes.
World Sickle Cell Day.
Yes.
So we have to, as a community, make sure that this remains a priority, keeping that at the top of our minds. Sickle cell is important. Those who are living with the disease are important. So I want to learn a little bit more about what's a life like, or day in the shoes of one of our sickle cell warriors.
So at the Sickle Cell Foundation of Georgia, I have over 50 employees working for me now, and 5 of those employees have sickle cell disease. And I'm excited that they're there at the foundation. The first thing that I want people to know, they're everyday people still. Mm-hmm. They have many skills, they're very educated, they're very talented, and they want to have a normal life. But through no fault of theirs, they have these challenges. They can start out early in the morning feeling great, feeling amazing. Out of nowhere, 10 o'clock, they've been taken to, the hospital for acute chest syndrome, or, just not feeling well. And so to watch them, it gives us a bird's eye view every day of what it's like to live with sickle cell disease. And I am proud that I was able to hire them and keep them employed so that they can have some sense of normalcy as it relates to their life, right? And so when we look at our sickle cell warriors, the challenges that they face, again, the stereotypes, the racism, being told that, oh, you're not in that much pain, or you're a drug seeker, you just want to get drugs. And I wish there was some device that we can have, Ashanti, that when our sickle cell warriors show up in the emergency room, I want you just to think about that for a moment. Who wants to go to the emergency room and sit for hours to be seen, right? No one will want to do that. But then to get there, and then for someone to say, oh, you're really not in that much pain, or you just here, seeking drugs. No, they're not. And so I wish there was a device that we can have some type of transference of that pain level that they're in, so people can really understand what's going on in the body. So every second, every minute, every 15 minutes, an hour that you are delaying them service, we've had so many of our warriors die inside of the emergency room waiting for care because someone dismissed them.
Mm-hmm.
Someone dismissed them. We have many employers that won't hire them because when they're out sick or if they're hospitalized, they fire them and look for an excuse to say, oh, the position has been eliminated or we no longer need this position, only to hire someone else and title it something else. And so they're then faced with, how am I going to live? You know, I have this apartment, I have rent. And that's what I'm really proud about the sickle cell community at large, because we all get together and we partner our resources. So they'll say, Tabatha, I have a warrior that needs, you know, X number of dollars for their utilities. They need it for their rent. And so we have to provide them with the resources that they need in order for them to have a day-to-day life, because they didn't get fired because they were lazy and didn't want to go to work. They got fired because someone made a decision to say, oh no, you know, we can't have you here because you're always out sick. But that's the life that they live. It's honest, it's true. And they're in pain and it's uncontrollable. So they need to go to the hospital, maybe get a blood exchange or maybe get infusion, a blood infusion or hydration. So they're in pain and we just want the world to wake up and acknowledge that they're in pain. And I am gonna say this on live TV. I do believe that we're discriminated against because it's a Black disease predominantly, but there are other races that are faced with sickle cell. But because it's a predominantly Black disease, I believe we don't get the funding, we don't get the access, and we don't get the awareness, because who cares about African Americans being sickly? But at the same time, we have cystic fibrosis and we have hemophilia. They have less incidences of individuals with those two diseases, but they get 10, 15, 20 times more funding and more access and more awareness than we do at sickle cell.
And we have to make a change.
We have to make a change.
And as a public health representative, someone who my whole training has been in public health, our focus is to look at what are the things that are influencing a person's health, the outcome of health. We call them social determinants of health, things that are going to determine your health. And if you look at, say, a child living with sickle cell, if they're sick, they're going to miss a lot of school. They need additional social supports. All those things that influence health, we're responsible for addressing them.
Absolutely.
So that no one's left behind. Absolutely. So that's why it's so critical and important. And I know Sickle Cell Foundation is located in Atlanta, but right here in Columbus in the Chattahoochee Valley, sickle cell is impacting us. So the next slide I want to put up shows a map of Georgia and where sickle cell is impacted most. And on that map, you can see that we're in the dark green.
Yes.
For being impacted by sickle cell right here in this Columbus area.
Yes.
So talk a little bit just about overall, because that's one of my wows from when you were sharing earlier, the numbers and the increases and even the undocumented increases. Talk to us about the numbers of people who are impacted by sickle cell disease.
So I'm glad that you said that, because, you know, in the United States, 100,000 allegedly, and I'm gonna keep saying that allegedly because I've been at the foundation for 10 years and I know every day there's a child born with sickle cell disease, but that number has never changed. One of the things I'm very proud of, Ashanti, is that you have Valley Health, and we've partnered. And as a result of that, we're addressing the needs of our sickle cell warriors. You know, we have a hematologist that was coming down to Columbus, but now we have a nurse practitioner on staff, you know, that we're helping supplement the salary to make sure that individuals with sickle cell disease are taken care of. And that's what it's about, collaborations and partnerships, so that we can address that, because we have many hematologists that are now retiring and new hematologists not coming into the market. And why is that? Because that same hematologist treating a person with cancer is going to get more money than they would if they were treating a person with sickle cell disease. So the numbers are huge, you know, 100,000 individuals, but we have multi-millions worldwide that are living with sickle cell disease. And in the rural areas, is even more impact of individuals living with sickle cell, because before, individuals have to travel 2 and 3 hours to get to Atlanta, to go to Grady Hospital, which is one of our partners. They have a sickle cell center there, just to get care. And so it was like, well, what can we do about that? So we're now, Sickle Cell Foundation of Georgia, we have local offices in Columbus, Macon, Hinesville, Augusta, and here inside of the Columbus area. And I would say that we are making an impact, you know, slowly but surely. We just don't have enough funding. If we had more funding, we could do more incentives to get hematologists that want to take care of our sickle cell warriors. But, you know, they're coming out of school and like, Tabatha, I'm sorry, but I have, you know, $400,000 in student loans. I got to go where the money is, and the money is inside of oncology and cancer.
And that's one of the baby steps that we have to take.
Yes.
Number one is increasing awareness.
Yes.
Number two, making sure that there's more access to care across the entire state.
Absolutely.
So everyone's not dependent solely on Atlanta. Right here in Columbus, this Chattahoochee Valley, we have a great population that's in need.
Yes.
So we want to have someone here, just like you said, placing the care where it's needed.
Yes.
And then policy, making sure our legislators, making sure we're advocating for the individuals living with sickle cell disease so that there can be some policy change around how we address it.
And I'm glad you said that. I was happy to see you at the Sickle Cell Day at the Capitol. Every February we go there and we talk to our legislators about the importance of sickle cell disease and why the funding is so important. So we go there and we advocate to get our funding increased. When we started going to the Capitol 10 years ago, we had $0 in the budget. Every year it was like, no, 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 no. And then finally, they gave us $25,000
Yes.
in the budget. Then it was $50,000, it was $100,000. And as of today, 10 years later, we're at $2.7 million. So I would say that our legislators and our state representatives, they do care. But we have to continue to advocate. We have to continue to show up. And this year, our Sickle Cell Day at the Capitol was one of the largest Capitol Days that we've had in a long time. It was over 400 individuals that showed up in their red representing sickle cell. And our legislators, they came in one by one talking to the group. That's still not enough. We have to continue to do that because, they're in session and they want to hear from us, what are you doing? What's different? What are you going to do with the money? And so we have to justify what we're going to do with the funding that they give us. And every line item has to be accounted for. We get independent audits to make sure that we're spending the money according to what we've written inside of that proposal. So the appropriations is very phenomenal. And then I love the fact that we have a lobbyist. His name is Andy Lord. And then we also have, he works with us. The lobbyists work with us. We had a huge advocate for sickle cell, Gloria Frazier, out of Augusta. And Gloria had been there for over 30 plus years, and she's the first one that brought sickle cell to the state capitol. And she just started advocating. And then right here inside of Columbus, we have Carolyn Hughley, who is a huge representation of sickle cell. And when we asked her, why was she interested? And she was like, I was in church, and there's these twins, 2 twins, and one has sickle cell disease. And we just watched what she went through, and we wanted to become involved. And so the people that are carrying the torch and guiding the way, they really care. We just need more people to do that. Absolutely. And we got to keep doing what you're doing, by you having this show, talking every month about the different health disparities inside of our community is so critical. And what I love is that you're right here inside of Columbus treating patients with sickle cell disease. And so that's critical. And we just have to continue, talking about it and sharing awareness about it. And I believe that there's hope in every heartbeat. And so if we continue to talk about it, we continue to create awareness, we will one day be seen and be heard loudly.
Absolutely. And we're taking those incremental steps.
Yes, we are.
And you mentioned something so important about somebody being at church and seeing 2 twins living with sickle cell disease. I think that's when it becomes real to someone, that they can see, they can identify and learn, hey, this is a struggle. So I want to bring you back to what you had already talked about a little bit before, to this next slide where we're talking about what are the common symptoms and what are the daily challenges of those living with sickle cell disease. Talk about some of those symptoms and the other chronic diseases that they have to live with while living with sickle cell disease. Can you speak to that?
Yes, fatigue, being tired, being in pain, being dehydrated, being frustrated, being challenged to fit in. As I said, sickle cell really doesn't have a look, but yet it does when you have yellow eyes and this jaundice. And people say, why are your eyes yellow? I have sickle cell disease. Oh, what is that? Can I catch it? Is it contagious? No, you can't catch it. It's not contagious. The chronic pain that they have, the tiredness that they have, we have to be empathetic and compassionate towards them because it's a struggle, Their liver being impacted, the kidneys being impacted. Many of them have their spleen removed. Many of them have vision problems. And so it is a challenge. And then I want people to understand not just that they have sickle cell disease, but it's also the common illnesses that African Americans face: diabetes, high blood pressure, kidney disease. So they still have all the other challenges as well, topped with sickle cell disease, coupled with it, should I say. And so these are everyday people that are in chronic pain. I can't express chronic pain enough. And what I would say to everyone, I would challenge them to just go and visit a sickle cell warrior being hospitalized. I think it would change a lot of mindsets of individuals that don't understand sickle cell, because when you go to the hospital and you see them there, really barely able to breathe, they may get pneumonia from being there laying down so long. It would change. It would change your perception. It would change how you react to it. It would give you more compassion and more empathy for individuals living with sickle cell disease. I certainly say that when I first started volunteering at the Sickle Cell Foundation of Georgia. I remember we had a classmate that had sickle cell disease, but really didn't understand it because they didn't talk about it, they didn't educate us on it. But when I went to the foundation and I met a young man by the name of Kadeem Harrison, I met a young man by the name of Blaze Eppinger. Watching them, I wanted to do something to help. I wanted to carry this torch. I wanted to change legislation. I wanted to change the perception. I wanted to provide them with a safe place. I wanted them to trust me, to know that I'm going to help. That's
so
what
important.
I wanted.
So important.
Yeah.
So we're going to go on a brief break. Thank you so much for joining us at Focus on Health. We're talking about sickle cell disease, why it's important, understanding sickle cell warriors, and making this a priority in our community. We'll be right back after the break.
I know the questions in your mind. I'm getting sickle cell beyond the pain. Now I believe that I can get through anything. Past the touch, now you can undo. Sickle cell beyond the pain.
I'm telling you, Rita, between my job, the kids' activities, and my night class, I barely even have time for this cup of coffee.
And I'm telling you, you have to make time for your health. I go to the health department for my GYN checkup. I get my breast exam, pelvic exam, and a pap test, and it takes less time than you think.
Well, I do take the kids there for their immunizations. I just didn't know they offered women's services too.
They sure do.
Make your appointment today. Visit westcentralhealthdistrict.com or call to find your local health department.
Welcome back to Focus on Health. We're so excited to be discussing sickle cell disease and sickle cell awareness today. This affects us in Columbus and our Chattahoochee Valley, and we're joined today by Tabatha McGee, who is the Executive Director of the Sickle Cell Foundation of Georgia. And we have learned so much already, so much. And I've had so many wow moments learning about sickle cell disease. What can we do? So I want to talk to you now about the educational resources, because we know this is important. We want people to get involved, but they have to learn more. They're not going to learn everything on Focus on Health today. So what educational resources are out there and available so we can know more about sickle cell disease?
Well, there are so many, but some of the funding that's going on with the new administration now is being cut, and so some of our programs are going away. But the first thing I would say is the Sickle Cell Disease Association of America, SCDAA. They're located in Maryland. They're the umbrella for all of the nonprofit community-based organizations up under that umbrella. And so I would say go to SCDAA, Sickle Cell Disease Association of America. You can find it on Google, just Google it. And then on her page, she lists all of the sickle cell organization that is a part of that organization, all the member orgs under there. We have the CDC. The CDC gives phenomenal information about sickle cell disease. We have the National Institute of Health. They give enormous information about sickle cell disease. Georgia Health Policy is another. And then, of course, all of the local organizations. We do a lot of work to make sure we're providing educational resources. So we have so many different sickle cell organizations in Georgia alone, but then worldwide. So you can just go to the Google and Google sickle cell disease, and all the information, all the resources will be there. And certainly at the Sickle Cell Foundation of Georgia on our website, we have a link to resources. And when you click on that resources tab, it'll show you all of the many resources that we have available. And one of the most valuable resources we have are our community health workers. Our community health workers are out in the field looking for our sickle cell warriors. They go to hospitals, they go to federal qualified health centers, they're going to the school systems, they're going to the school system, universities. They are going looking for our warriors. And so I want people to know, call your community health worker. And on our website, sicklecellga.org, there's a plethora of different community health workers that we have. We have one inside of many different rural cities here inside of Georgia. And those community health workers, they work hard finding all of the resources that our sickle cell warriors need just to function on a day-to-day. Mental health is critical inside of that as well. You know, seeking therapy. It was a taboo at one time inside of our community. You know, African Americans didn't feel like, oh, you know, if I go and see a therapist, people tell me I'm going to see a cuckoo doctor. Well, that's a stigma, that's a social stereotype that we got to get rid of as well. Because people that are in chronic pain constantly, you can imagine the mental anguish that they go through. And so we now have 3 mental health therapists on staff at the Sickle Cell Foundation of Georgia. And our numbers are increasing weekly, monthly. And we just celebrated our 1-year anniversary of our Sickle Cell Sanctuary, which is a haven, a safe place for our sickle cell warriors. And they're coming from all over visiting the Sickle Cell Sanctuary that I opened last year, June 18th of 2024. And my vision was to create a safe place, a home for our sickle cell warriors. You know, cancer have home, diabetes have a home, but there was no home for sickle cell warriors outside of the hospitals. And I wanted to create a very serene, relaxing environment for holistic health as well, coupled with traditional medicine. And so we have infusions, reflexology, massages, facials. They can come and really get taken care of. We have a hematologist that will see them, fill their prescriptions. And so I just heard that there was one that was open in Washington, D.C. for Howard University Hospital. They just created a wellness center for our warriors. And then in California, they just opened up a wellness center for warriors. And so I'm like, yes, keep going. I want every city, every state to have a wellness center for our warriors because they deserve a safe place. They deserve that when they walk in, they're greeted with, hey, how are you today? How can I help you? What do you need? And we immediately, as soon as they walk in, click into action to take care of them, get them triaged in, and take them to the back. And the senses are so important. So when they walk in, it smells good. When they walk in, soft music is playing, so it feels good. When they walk in, we make them feel good because we know what they are fighting on a day-to-day basis. So there is a plethora of resources that are available. And I tell people, just go to Google, type in sickle cell, you'll be amazed at what comes up. And partnerships and collaborations are so key. They're so critical. And I tell everybody, there's nothing I'm not willing to share about how I founded the Sickle Cell Sanctuary, how I founded Unveiling Sickle Cell Beyond the Pain, our talk show as well. I'm willing to share that because if it can help a warrior, that's all that matters to me.
And we know, and I say we, I represent Valley Healthcare as well. And we're a community health center, one of those FQHCs that you mentioned. And when we came over to see the Sickle Cell Sanctuary, our jaws dropped. They just dropped at how amazing the facility is and how welcoming it felt. And a sickle cell warrior who's living with the daily challenges that you educated us about earlier needs to have that experience.
They do.
And so you're so humble, you know, you played it down, but your sanctuary is the first in the nation of its kind. And I am committed to us having a sanctuary right here in Columbus.
Yes, you are.
You heard it first
Yes,
here
you
on
are.
Focus on Health that we're going to get one because it's so important.
It's so important.
To have that level of care for those who are living with sickle cell. So we're excited to partner with you to do that, as you're the champion to bring that priority here in Columbus. We call ourselves in Columbus, we say we do amazing.
Wow.
And the Sickle Cell Sanctuary is amazing.
Thank
and
you.
we want to have that right here in
Thank you.
Columbus.
I can't wait till you have one. You and
We're
I have talked
excited.
about it already.
Yes.
And it's life-changing. And my only priority was our warriors. The only thing I thought about was our warriors. You know, people always like, you don't tell anybody your story. Like, no one knows really about the sanctuary. And then I say to myself, I really can't describe it. You have to come see it in order to understand it. It was a journey, it was a labor of love. And it was born out of, I had a son, Melvin, and Melvin unfortunately passed away at 20 from epilepsy. And we went through some of the same exact challenges as our warriors did. And so unfortunately, I wasn't able to save my son. And so here's my opportunity to help a lot of sons, to help a lot of daughters, nieces and nephews. They call me, Aunt Tab, and some call me Mom. So that's my gift back. I'm like, every day when I'm working, I am honoring my son's memory that he had some health challenges and he was constantly ignored and looked over and not seen or not heard. And so I wanted to create that for our warriors, that when they walk in, they're seen and they're heard.
That's wonderful. We want to talk a little bit about children since you brought up your son. And that mental health component is so important. Last month on our show, we talked about mental health. It was Mental Health Awareness Month.
Yes.
And why that mental health aspect is so important on the journey of those who are living with sickle cell disease. But children, of all the things they have to go through anyway, the developmental things and the challenges in school, all those things wrapped up, and in addition to that, also having to live with sickle cell disease, I know that you all have a special camp for kids and for students. Talk to us about that camp.
Camp New Hope is going on 47 years. I think it's 47 years. 47 years of being in existence. And so it's now Camp New Light, but it started off as Camp New Hope, formerly known as Camp New Hope. Is Camp New Light now. And we accept children ages 7 to 17. And it creates an environment of a safe place that a child can go away, is 24/7, medically supervised, ACA accredited. And we teach them about their disease, how to manage their disease, but also it's a place that allowed them to be a child for a week and just have fun without all of the day-to-day challenges that they go through. Do some of our sickle cell warriors get sick at camp? Absolutely. But the great thing about that is we have all of these volunteer doctors from all these major hospitals that are there on site to treat a child immediately if a child gets sick. And it also gives the caregivers that we don't give enough credit to as well, an opportunity to have a week off just to rest their mind because they know that their child is in a safe place. And so I'm really excited, all the cities all over Georgia, they send their children to Camp New Light for that 1 week, 6 nights and 7 days. And when they get back, we have a big back to school bash and we provide them with all the school supplies that they need. And thanks to our sponsors, Pfizer and Agios, they provide us with the funding to create these care packs that we can give to our children for supplies. And that helps the family as well, because many families, they're financially challenged because they have a child with sickle cell disease. And oftentimes, after they've missed work for several times, their employers let them go. And so we're always looking for opportunities that we can help the caregivers, we can help the other siblings, and we can help our children. And it is a little different, Dr. Hiltz, when it comes to children, because CHOA takes care of Children's Healthcare of Atlanta, take care of the children. So they have a little bit more protection, they have a little bit more, they're seen a lot more. But as soon as they turn 18 and they're transitioning from pediatric care to adult care, it's an entirely different world. And so that camp is designed to teach them all of the resources and everything that they're gonna need when they're transitioning from pediatric care to adult care, because it is a difference when they get to adult care.
That's an amazing resource.
Yes.
Amazing resource.
Yes.
And so the citizens of Columbus and the Chattahoochee Valley who are watching this show, they need to know that if you know a family who has a child with sickle cell disease, Camp New Light is available to them.
It is.
This is an opportunity for them to go away, have a break, get respite, learn more about their disease, how to manage it. I think it's just an awesome opportunity, and we're going to be advocating for that.
Oh, wonderful. And they can go to sicklecellcamp.com and they can register, and we do have scholarships available for parents that may be financially challenged and can't pay for that week. We do have scholarships available. You can fill out the scholarship application on there. And many times for the last 3 years, I've made camp completely free for all, because we have these amazing sponsors. I go out and talk to them and shake their hands, like, is there anything you could do to help sponsor the camp so I can send the children to camp for free? And they're like, okay, Tabatha, fill out the proposal, the sponsorship, and we'll think about it. And they come back and it's like, yes. And so for the last 3 years, camp has been free for all our parents.
Wonderful.
I know. I'm so excited.
That's great.
I'm
That's
so
great.
excited
That's
about
great.
that. I'm so excited about that. And so the kids get to go and be kids. And our staff that's involved, Kadeem is the director of the camp. He's a young man living with sickle cell disease. So all of our counselors have sickle cell disease. And so they was once a camper themselves at Camp New Hope. Before it was Camp New Hope, but now they're coming back and they're providing services to their children because they know what it's like. They know what the child goes like. They know how to identify when a child is not feeling so well before the child go downhill. Okay, let me go and get them some hydration. Let me go and get them some more water. Let me give them, a Tylenol first or aspirin first to make sure they're okay. And so the camp is unique. It is designed by us for us, and I absolutely love it.
Thank you. Thank
You're
you so
welcome.
much.
You're
So,
welcome.
Final thoughts. How can we get involved? How can we learn more? We've heard so much of what you had to say. We know that Valley Healthcare System, we have a sickle cell clinic now in partnership with you. We know we have the Sickle Cell Foundation of Georgia. We know we have the Association of Sickle Cell for the Lower Chattahoochee region. So we have resources. But any other final thoughts about how Columbus and our community can get more involved in sickle cell advocacy, education, employers knowing more about the disease so we can be empathetic and support each other as we know that we have residents living with sickle cell?
So the first thing I would say, this TV show that you have and you're doing once a month, continue to bring awareness on this show by having a caregiver come to talk about sickle cell, having a warrior come to talk about sickle cell, perhaps a hematologist that are treating people with sickle cell, have them come to talk about it. Have our community come out, the ones that are serving the sickle cell warriors, and we call them boots on the ground. Have them come out, talk to our community health workers. And then ultimately, I would say go to our website. We have a lot of events that we host, every month. And we have so many different events coming up. We have the 5K Road Race Walk that we have coming up in September. We also have a conference, a legislative conference that we're doing so we can teach individuals how to advocate and talk to their legislators about sickle cell. That's October the 31st and November the 1st. It's a 2-day conference. We also have a gala that's coming up in December, the 4th gala that we're having. Incredible. The warriors look so beautiful, Ashanti. You have to see them. They're all dolled up. The men are in their tuxedos. The young ladies are in their gowns. And it is a night for them. And we have a great time. And so go to the website, sicklecellga.org. Go to your website, visit us, come see the sanctuary. If you know anyone living with sickle cell disease, they have to come visit the sanctuary. It's life-changing. And I can't wait until your wellness center here open up. And then we're gonna have your wellness center. And I just would love for us to continue to do what we're doing. You and I collaborate, we share resources. We have Dr. Buckner that is there in place. And so just continue to share in resources and partner with our other CBO organizations here inside of Georgia. We have Lois Williams. Lois Williams has been around for decades,
a
long time.
Advocating for sickle cell.
Yes, advocating for sickle cell. So partnering with Lois, partnering with Dr. Mitchell, who's over in Hinesville. And, we have Gwen Morgan. We have Gwen Morgan with Lockhart Association. We have Mapilla Don with My Three Sicklers. All of us in Georgia have partnered together. We're collaborating together. And as a result of it, we're putting our resources together. And now we're able to serve more of our warriors. Dr. Bailey, she has a conference coming up in, let me see, what month is this? Oh, it's in July. It's the week after camp. She has July the 10th through the week before camp is the 10th through the 15th. And it's gonna be in Orlando, Florida. And she focuses on the warriors. So it's really a warriors conference, but she has a conference coming up. And then SCDAA, they have a conference that's coming up in October in Illinois. And so I would tell people, get plugged in. Come out, go to the conferences, support the conferences, come to Sickle Cell Day at the Capitol in February, and just continue to be plugged in.
Awesome.
Yeah.
Well, Tabatha, thank you so much for being with us today.
This has been phenomenal.
It's such an important topic, and we're so glad that you were able to take some time to share with us.
Yes.
Those of you who are watching, thank you so much for tuning in to Focus on Health. Sickle cell disease is such an important topic. It's a priority for us. We're going to continue to learn more. You heard tons of resources. please get involved. And we'll see you next time on Focus on Health.